More people coming in. We've got some stragglers. I'm just letting some people in here real quick. Okay. Looks like we're live, at least on Facebook. So you're on candid camera. Don't pick your nose. All right, a couple more people coming in. We'll go ahead and get started to be respectful of everyone's time. Just a couple of reminders. You open the meeting with your microphone off and your camera off. You're welcome to turn on your camera. It is being recorded, and we're going to post this on our website and on social media outlets. So just to let you know that. And we'll get started. I got away from doing the normal intro when we're in person, so I thought I would start with that. If you don't know where you are, this is the UIndy Senior Living Series, and since since April, we've actually been on Zoom, which I know is not ideal, but I feel like there's a light at the end of the tunnel, maybe the end of first quarter, so that's great. I am Lisa Treadwell. I'm a realtor with Century 21, and I specialize in helping seniors downsize into low and no maintenance living. This is a free educational panel, and it's free because of these wonderful sponsors you see here on the screen, and we're going to get to them. We're going to have them go around and quickly introduce themselves, and we have a couple of sponsor highlights who are present. I actually think both of our sponsor highlights had to call in, so you're not going to be able to see them on video, but one, his power just went out, and the other one is having tech issues, so, but that's okay. So what we'll do is we'll start with the other sponsors first. Our highlights today are J-Dog and Eagledale. And you haven't seen much of them because Eagledale, if you remember when we were in person, they provide those beautiful flowers that we gave away every month. So, so we're going to start with, I'm still admitting people, lots of people coming in here, so bear with me. Okay, let me see my screen here and just see who I see on here. Let's start, I see Misty. Hi. We'll start with you just because I see you, and then after that we'll go Dave, Holder, and Lisa if she's here, and then Jeff. How's that?
All right, I'm Misty Fonz with Folklore Productions. I create legacy videos, which are videos where seniors share their life stories and their family history and get that on film to pass down to future generations.
Great, thanks.
Is that me?
Yeah, go ahead, Dave.
All right. Good morning, everyone. My name is Dave Holder. I'm the owner of Assisted Living Locators of North Indianapolis. If you are thinking about transitioning to senior living, be it independent, assisted, or memory care, we can help you with that. We're not just a referral service. We work with you for placement, step by step through the process, and it's no cost. I'd love to be a resource for you. Thanks.
And then is Lisa here?
No, she's actually had both of her knees replaced. So
goodness.
Now, so okay. Yeah, she's doing good.
Okay, we'll go to Jeff, and then I see Sara got back on, or Sara got on too. So go ahead, Jeff, and then Sara.
Good morning. I'm Jeff Stinson. I'm a elder and special needs law attorney in the Indianapolis area, helping folks with their planning, in particular planning for access to valuable public benefits to help pay for care without being completely impoverished.
That's good. Go ahead, Sara. Oh, you're muted. Yeah, well, it says you're unmuted. Yeah, there you go.
I'm unmuted. Can you hear me?
Yeah. Yeah, we can hear you now.
You can hear you? Oh, okay.
Yeah,
okay.
I don't know why it didn't.
No, that's okay. So I'm Sara McCord. I'm with BrightStar Care. We are an in-home care agency, and we're going to talk more about that today. But just thanks for everyone being here, and hopefully you all get to learn a little bit more than you came about home care today.
Yeah, we've actually got a really large crowd, so I feel like people are rallying. We are doing the peaks and valleys of this Zoom and COVID and everything, and maybe we're in a peak today because there's a lot of people on, so that's great. I see Laura Roman next, so you want to unmute your mic and introduce yourself?
There we go. Hi, I'm Laura Roman, and I'm the Director of Marketing of Westminster Village North. We are a continuing care retirement community located on the northeast side of Indianapolis, and very proud to be a sponsor of the series for several years now. I don't know if you're going to mention any upcoming events, but we will be hosting a virtual open house 1 week from today, and my team and I will be doing a tour of our community, not only the independent living, but also assisted living and skilled nursing. We're going to be looking at apartments and homes on our virtual tour. We're doing a run through today, so fingers crossed that we don't have any technical difficulties.
Oh, good.
Thank you.
Run-throughs are always great, and if you obviously need my help, just text or call me. You know how to get a hold.
Okay, thank you.
Yeah, okay. I'm looking for other sponsors. You guys just unmute yourselves because we have so many people, and start talking if I've missed you. Is anyone here, Sean, is anybody here from Sycamore Reserve? I don't see anyone. Okay, how about Marquette? I know Tiffany was going to try to jump in here. We did BrightStar Care. Rachel from Security Title. Anthology. Seniors Guide. I don't want to miss anybody. Heritage Woods. Well, they're missing out on some great content, aren't they? And okay, so we'll go to our featured sponsors, and it looks like Patrick, you made it online. Not you, Broccolo. Sorry, I saw you look up Cummings with J-Dog Junk Removal. So you want to go ahead and just give us an overview of who you are, what you do, why your company is special, and how we can work together to serve seniors.
All right, cool. Thanks. Yeah, my name is Patrick Cummings. I'm the owner of J-Dog Junk Removal. We are a full-service junk removal company servicing Indianapolis and all the surrounding counties. We are veteran-owned and operated. Every J-Dog franchise is owned by a military veteran. And how we can be of service in this realm is that we offer services that go anything from just a single item or a few items to full home cleanouts and hoarder situations. So if you are looking to downsize and have a lot of stuff that you don't need anymore, we are a great solution for that. Or if you just need a garage cleaned out, or an attic, or a basement, or a room that's become a catch-all over the years, that's sort of what we do. And we've been working with Lisa since, I believe, the end of 2017. So, and been sponsoring all this year. So that is, any questions, feel free to send me a private message during this Zoom, and I will post my phone number as well.
Yeah, please do that. And if you are a sponsor, go ahead and throw your information into the chat box, your website, contact information, any sort of specials you have going on, or something like that. I wanted to say one thing special about Patrick and his company is that he works in conjunction with our auction service that we use. So, I mean, everyone that we use, they are very collaborative, and makes the downsizing and decluttering process really nice and smooth for everyone. So, which is the point. So, okay, so I'm texting with Tiffany. She is ready to go, she says. So, Tiffany, you're on.
Hi, I'm Tiffany Westler, third generation of Eagle Dove florists. We are a full service florist doing everything from the simple rose for date night or birthday bouquets, funeral arrangements. We've been here 62 years, and we're just always happy to help people send their emotions one petal at a time. We're doing a drawing for Thanksgiving. So if you want to sign up, you can just email me at tiffany@eagledoveflorist.com. And we're doing a free Thanksgiving centerpiece.
That's awesome. And her flowers are amazing. And if you've ever attended the in-person events and won the flowers, I don't know, where she gets her flowers or what she does to them, but they last for a solid 3 weeks. So thank you for joining.
Awesome. Thank you. Yeah, there's different grades of flowers, like there's different grades of meat. So yeah, we just use the highest quality that we can find.
That's awesome. Thanks,
guys.
Well, it looks like we've got everybody in. The stragglers are in. We're live online. I've checked everything like that. And if you are online or if you're calling in, remember to just online type your questions. I'm watching Facebook and YouTube. And then if you're calling in, you can hit the *6 button, and that will alert me that you have a question. And so without further ado, we'll go ahead and introduce our panelists. Patrick Broccolo, I saw you first, and so we'll go ahead and start with you. So we'll just go around the horn, just say who you are, what your company is, how you serve seniors, and maybe why you're different from your competitors.
Sure. Can you guys hear me?
We can hear you.
All right. Well, first of all, it is so neat to see all my friends and community partners and referral sources. I miss you guys, seeing you in person. It's great to be with you today. My name is Patrick Broccolo, and I'm one of the co-owners at Senior One Care. And we are a home care company that started because of our grandmother. And we just had a tough time finding reliable people to take care of her. So we started the business about 15 years ago and are serving central and northern Indiana and have about 300 caregivers serving seniors throughout our town. And basically, we're just helping bring a smile to people's faces and helping with everyday activities of daily living so they can remain independent wherever they call home.
That's awesome. Have things changed drastically since COVID? I'm sure I'm hearing a lot from other people.
Yeah, things have, there's definitely been some things that we've had to change. Definitely working in a virtual world is one, but one area that we've really targeted is workforce and trying to help a lot of our community brethren out there who may have been downsized or have lost their place of work, giving them training so they could jump into this wonderful industry to serve not only in home care, but also in many of our local nursing home facilities, assisted living, helping them get jobs there to really help seniors through this difficult time.
That's awesome. Okay, you are up again, Sara. Go ahead.
Hi again. So as I said earlier, I'm Sara McCord. I am with BrightStar Care. We are an in-home care agency based here in the Indianapolis area. Our office is off of Meridian and 91st Street area, but we service all of the Indianapolis area and surrounding. I have been in senior industry for 15 years now. I had to think about that for a minute. In a couple different realms, but in home care setting for the last 7.5. So yeah, we're just here to help people navigate this transition of life and how they move from one stage to the next and how they can do that safely and comfortably. And we're here to help along the way. So.
That's awesome. And I know I just saw you yesterday and we were talking about lots of different things going on, and we'll dive deeper into that in our conversation too when we get to the questions. And I want to introduce Leah Jones with Joy's House. I think I saw her on here. Leah, are you there?
Yeah, I'm here.
I have to scroll through all the pictures.
My name is Leah Jones. I am the family care manager for Joy's House at UIndy. Joy's House is an adult day service. And so the person living with a life-altering diagnosis comes and spends the day with us while their caregiver either gets a chance to go to work remotely, or just take care of themselves. And then they pick them up and go home. So it is kind of a mixture of all sorts of services, because you get the congregate setting, you get some of the supervision during the day, and families can come as little as 2 days a week or as many as 5, depending upon their need. I am also the current treasurer for the Indiana Association of Adult Day Services. And there are currently 53 adult day services throughout the state of Indiana.
Wow, I guess I didn't know there were that many, but you guys have been around for a long time and even expanded, which is great. Okay, so I'm already getting questions in the panel, which I love, or in the chat box, which I love for the panel. And you guys can see those there. We have a set of questions that you were all able to download from the newsletter that Julie sends out. And if you weren't able to download that, don't fret. We will post it on our website and social media, and you can also reach out to either myself or Julie directly to get a copy of that. But it's basically the questions that we're going to go over. It's a list of our sponsors and how to contact them, and also a list of our panelists and how to contact them. You can also see it on your screen there, and if you're really tech savvy, you can take a screenshot and you'll have their information there. And I think later we'll repost the sponsors. I think we have another sponsor slide at the end. Yeah, okay, so we'll dive in here. The questions, we'll ask each question, have the panelists answer. We can go in that order, that same order that we did the introduction, just so we're not talking over one another. And then again, if you have questions, type them in the chat. You can use the little icons to raise your hand or just unmute your mic and start talking. If you are on Facebook, type in the comments there, and I'm watching that. And if you're on your phone, just hit *6 and that will automatically alert me. So, all right. So question number 1 is, what is the difference between home health and home care?
Yeah, so this is a great question. We get this a lot. So terminology wise, home health care, and Sara can speak a little bit more to the home health side, but they're really covering nursing and therapy care. It's usually ordered by a physician to come in and help with physical, occupational therapies and hospice. And it's usually paid for by Medicare. And can be temporary, really, to help you kind of get back on your feet and those kinds of things. Home care is the non-medical side, or what I like to say, we do everything else. So we help a lot with homemaker services, companion, and then a lot of the personal care side of things. So you may have heard terminology like activities of daily living. So feeding, transferring, bathing, just helping get dressed, those kinds of things is really what that non-medical side is there. And that's really where kind of the differences that I've seen between that home health and that home care side are.
Yeah, I would agree. Everything that Patrick just said is spot on. The main thing I explain to people is the home health side is physician ordered. So you have to have those physician orders to receive that care. And it's usually for a shorter duration of time. You know, maybe 3 weeks, 6 weeks, somewhere in there where there is a skilled need to either get you back to your previous function level, or as close to that as possible. So those are things like your physical therapies and occupational therapy, speech therapy, wound care. Home health also can encompass, you know, the hospice care and palliative care, that type of area. And then the home care side is just what Patrick said, everything else, those daily things from the time we get up to the time we go to bed, and even while we're sleeping, if there's some assistance needed, then we can be there for those longer durations, as often and as long as you need. And there's not a timeline on that, like there is more with the home health side.
So the nice thing with an adult day service provider is we play nicely with both home care and home health. You can actually utilize both services and still have a loved one attend an adult day service program. The home health and the medically ordered care does not impact the homebound status that Medicare requires for someone receiving skilled care.
That's good. Sorry, I was trying to unmute my mic real quick. You guys are great because I don't have to go on and say, okay, you're next. You guys are just jumping right in there. So I appreciate it.
Lisa, one quick thing I'd just add too is many times home health and home care coordinate with each other.
Yes,
there's very often times, and I'm sorry, also adult day, as was mentioned earlier, we do definitely work together in circumstances, because there's often times where we're working with the family and we recognize, hey, they could use some additional therapy and physical therapy, and we'll refer many home health groups to assist in those kind of scenarios. So it's not an either or, it's really a full suite of services.
That's a really good point, Patrick. I'm glad that you said that. And I know I hear you guys all the time. You play fairly and well in the sandbox together in terms of with the ultimate goal of just helping seniors get what they need and when they need it and how they need it. So that's what I love about this industry. So really, somebody can have all three of your services going at the same time. Okay, are there any questions over what they just spoke about? I see that we have a couple in the chat box. I'll just review these. One says home health care is mostly covered by Medicare, as Patrick said. Is anything covered for the home care side by Medicare or any other agency? That's a great question. Thank you, Mr. Callis.
Yeah, so it's a great question. The question is, who pays for services? What are some of those payer sources on the home care side? So again, that's that non-medical space. There's a couple payer sources. One is private pay. So Medicare does not cover non-medical home care, but families will pay for it privately. Medicaid does pay for non-medical services. There's some income standards you have to meet in order to qualify for those types of services. And our good friend, Mr. Stinson, can also be a help in this, but There's a wonderful veteran aides and attendance benefit that also cares for folks. And then we've also helped some families who happen to have a long-term care insurance policy. In many cases, those also can help pay for services. So as far as payer sources, that's kind of the big four off the top of my head that definitely we're seeing people are using.
Yep, I would agree.
The additional ones for adult day service are a state program called Choice, which doesn't have the financial constraints that Medicaid waiver does. And the Title III program monies that are given out to the area agencies on aging. And adult day services are just starting to break into the Medicare Advantage plans, and they are kind of dipping their toes into paying for adult day services. I think it's like 1 day a week at an $80 reimbursement to the person who receives the Medicare Advantage.
Well, that's great to hear. We have several more questions in the chat box, which are great. Keep them coming. I'm going to do my best to get to all of them. One person has several questions, so I'll read them off here. You can see the chat there too. One of them says, who provides senior companion care? Does anyone want to jump in there on that one?
I'm sorry.
Oh, and also what sort of certification is required for that companion care?
Sure. So on the companion side, they technically, because it's non-medical work, there isn't any specific certification that one needs to be a caregiver, as I will call them. So many of us are caregivers right now of our own spouses or loved ones, or you may know someone who is. And each, I would say, organization in the non-medical space trains their caregivers in ways to meet, certain needs that are out there. So from Senior One Care's standpoint, we started our own training school called Legacy CNA Training. And so we've looked to hire a lot of what's called a certified nurse aide, which is a certified training through the Department of Health. But they don't need that certification to care for others. Honestly, they need to have a really big heart and want to, change people's lives and assist folks who just need assistance. So a lot of the training that caregivers should be receiving are, in today's world, definitely infection control. The hand washing techniques, how to wear protective equipment in cases that need that. But also there's proper ways to care for someone, whether it's good body mechanics on transferring or assisting someone out of a chair, as an example. But one training I certainly don't have is meal preparation. I am not really good at that. So, but someone who has that kind of background would be a wonderful caregiver in this time.
Yeah, I would say most home care agencies are going to be able to provide that companion care and then go on up with needs as needed. But so yeah, I would say that, most home care agencies, I know at least both that are here today, are able to provide that companion care. And it's really just a matter of meeting with that individual and determining what that looks like for them and putting that plan together based off of what their needs are. So, yeah.
I liked what you said, Patrick, about one of the most important things is just somebody who has a passion for caring for seniors, because if you have that, I think you can train the rest of the stuff, but if you just don't have that in your heart, you just don't. It's no judgment, but that's something that you can't train. So that was a really good point. There were a couple of other questions, and I know you can't see them all in the chat, panelists, because some of them were sent privately. I just want to make sure that we get them all answered. We talked a little bit about what sort of restrictions and extra additional, training is being done for COVID. I guess it says, I'm trying to, correct me if I'm not saying this right. The question is with COVID, okay, so the whole thing was, who provides senior companion care? Do individual companion care providers need certification? If so, who provides that training and certification? Patrick mentioned his school. And then it says, with COVID, we want to have family and friends serve in this role. So I think what she's asking is, if there are friends and family members who want to be primary caretakers, are there training classes that they could, or resources that they could participate in to better care for their family members?
Yeah, that's a great question. And there are some training providers out there that are offering information on their websites and Facebook, social media channels on, just some tips on how to care for another individual. We all know how to do this work because we've done it before with our own family members. It really does take a true heart. When it comes to other specific trainings, there's certifications that you can get if that's a pathway that you want to go. There are, like I said, training schools that are out there that are actually licensed to provide that technical training that's out there.
Yeah, you would, Patrick, school is great. But you can also just Google like CNA or Certified Nursing Assistant programs, and you'll be able to see who pops up in your area to do those classes and where.
There's a really good book too. If you're a book person like I am, I like to have books to refer back to, but there's a really good book by David Soley called How to Say It to Seniors, Closing the Communication Gap with Our Elders. I know it doesn't speak fully about the caring for them, but it's almost like a book that would be required in a class if you were caring for seniors. So it's called How to Say It to Seniors by David Soley. It's a good book. You can get it on Amazon.
Lisa, one other thing too that might be helpful is, we work with a lot of folks who are working through Alzheimer's or Parkinson's. There are some wonderful associations that are associated with diagnoses that also have wonderful resources for caregivers to look at. And Leah is another one at Joy's House. They have wonderful caregiver trainings, supportive services. So there are resources out there for folks to look at. I'd also encourage you to consider senior centers out there that are in your counties that also have localized groups that you can target for other areas for help.
One that I was going to mention, and I know it's they've moved to an online educational thing, is the Dementia Friends Indiana. It gives very basic, but also that foundational knowledge of how to interact with someone who's living with dementia, and just the processing that you need to allow that person that you're caring for.
Sorry, I was muted. There was a question specifically for Sara, it looks like, and I know, Patrick, you touched on this a bit, and this might be a question, just an individual question to maybe after the event. It says, does John Hancock long-term care pay for home care, companion care, or anyone can, she says, who can answer this?
Yes, if you have a John Hancock long-term care insurance policy, then each policy is different. So you would have to look at your individual policy to see what it covers. But in a general speaking, yes, they generally cover home care, assisted living, that kind of area. And then it's policy specific as far as what your daily allowance would be, as far as what they cover, and then what that would cover with the agency that you choose. So, we're all within a couple dollars of each other, I think, price wise for the most part. So you would just have to see what your daily limit is on your policy, and then see how that transfers over to what it would cover with a home care agency. And usually starting that process starts with the long-term care insurance policy, because they will do an assessment of their own where they are going to determine that you qualify to use the policy, meaning general terms again, but usually have to have at least 3 activities of daily living that you need assistance with in order for that policy to kick in and qualify to use it. So I hope that answers the question.
I think so. And again, just, type in the chat box if not, and we'll do our best to answer. I'm going to move on. If I don't see any other questions or hands raised or anything, if I'm missing you, I apologize. We have a big group here, which is awesome to see, but easy to miss somebody. So question number 2 is, how does one sign up for services from a home health or home care provider? So we're all meeting, and some of the people on the event, on the call today or the meeting, are primary caretakers. I hear this every day. My spouse his health is declining, and I'm feeling overwhelmed, and I'm his primary caretaker. Or so how does one get started if they wanted to use one of your services?
Yeah, so in our space at Senior One Care, we were in those shoes personally, trying to find the resource and reliable folks. And so one of the things that we wanted to make sure we did was we had a couple nurses on our team who are able to really work through kind of what types of services or needs do you truly have inside the home. And so if they're non-medical in nature, obviously we set that up. But the first thing we'll do is we'll come out and meet with the family, because we want to learn a little bit about who you are. So families would call into our 24-hour on-call phone, and we would set up a time to meet with you. Free consultation, just kind of get to know each other and see what kind of the needs are. And then from there, we look at the next steps of, what kind of schedule are you looking for? And we kind of look back at our roster and who would be a really good fit to kind of be that caregiver out in that home.
And that initial assessment, Patrick, is that a free assessment? That's something we get asked a lot.
It's free. Yeah, for us, it's free. It's a free consultation. And so there's the phone call, where we're getting kind of what the situation is. And then if someone were to come out and meet with you, that also is a free consultation. We want to not only see if we are the right fit, but we also want to help get a lot of our community partners that are on this call involved if we feel like it's a good assistance as well.
Yes, same for BrightStar. We have a free assessment consultation. We actually call them living room visits, because oftentimes we're sitting around in the living room, and it's education for all of us. So it's education for us to learn about you and your needs and what you're wanting. It's education for you as a potential client to learn about what we can offer. And I have had those meetings with just an individual. Sometimes we have, 5 or 6 children present, and it can be a large group too, so that everybody is on the same page and learning together. So that's part of the process. We also always have one of our registered nurses that comes as well, either at the same time or there right after. And that's free as well. And that is to set up that care plan for you once you decide that you do want some services. So those are, where we're going to go through your medical history, and we're going to find out what's specific to you and your needs, and how we can put the best care plan together for you. So that's the home care side of it. With a home health provider, as Patrick mentioned, oftentimes we can see that need as well, and we will make that referral to a partner if needed for, therapies and that sort of thing. But that process is very similar. It's just a matter of making sure that home health company is able to get physician's orders, because they do have to have that, which is a little different than the home care side.
Ours is somewhat similar, except the potential guest comes to the house with their caregiver. The caregiver then meets with either myself or Teresa, who's at our Broad Ripple location, while the guest spends time with what potentially is going to be their next social group. It also, by doing this, it gives us a good indication if we're a good fit for them and they're a good fit for us. We also give our caregivers that time to speak freely and not in front of the person they're caring for. Because a lot of times what we find, if the person they're caring for is sitting next to them, they don't give you the full picture of what's going on. It's much easier to speak freely if the person that you need a break from is not sitting to your right or to your left. We also make it last. We want to know about that person. Their caregiver is the expert. We're just strangers. So I want to learn from the expert that Mrs. Jones here needs coffee and a bagel in the morning before she comes to the center. So those are just a little bit of how we proceed. We also do have a physician's form that families have to fill out before they can start.
That was a really good point, Leah, that you made. I was talking to a gal yesterday who is ready to downsize, and she kept saying we, and I said, you keep saying we, so it sounds like, you're doing this with more than one person. And she got really quiet, as if she was like in the phone like this. Yeah, but he doesn't want to move, It was like really, quiet. And she was telling me all the stuff that you're saying, when you get them like a little bit separate, we can speak freely. So yeah, that's a really good point. And somebody asked about the Facebook, how can you view it? And I'm going to copy this. Julie sent it to me in a private message. I'm going to paste it here. So there is the link, Sheila, in the chat box there. If you just click on that. Yeah, it's just my downsizing indie page. So the last time I looked, there were a couple of viewers, and then I shared it on my personal. So feel free to share the video. The more the merrier. Did we have any specific questions about how to get started? I know that this is a ton of information and there are a lot of people on the call. It can seem overwhelming to get started. And I've said this before, if you don't know where to start, you can reach out to any one of us, whoever you feel most comfortable with, any of the sponsors, any of the panelists, and say, this is what I'm looking for, because we're very collaborative in nature. So if you don't know where to start, just pick a person and give us a call. Okay, so question number 3 is, what type of service provides the best resources for aging in place? Which type of service provides the best resources for aging in place? So aging in place is a big buzz term, or aging in home. We hear it a lot. I'm aging in my house. So maybe talk a little bit about that and how the three of you help people age in place.
Yeah, this is a great question, Lisa. And my quick answer is that the best type of resource for aging in place is a customized service. I think everybody has different needs. One other point to bring up about home health and home care is it doesn't matter where you call home, because in many times we're also helping folks temporarily or permanently who may be in the wonderful senior living communities that are out there. So for our perspective, we're trying to help prevent unnecessary hospital stays, prevent accidents, maybe agitation. And we had a client who fell and hurt herself. And when we asked, what had happened, she said, well, I wanted to get a drink of water, in the middle of the night, and I wasn't going to ask for any help, and she went and did it on her own because we're all, independent and we want to do those things. So we can provide just kind of that assistance there. The other piece too is just having experienced eyes on the situation. I really like that kind of thinking. Just let us get our eyes on the situation, because when we go into as Sara brought up, a living room or a home or wherever you call home, we can see just those little pieces of help. Maybe it's a grab bar in the restroom. Maybe it's my least favorite thing in the world, which are throw rugs, which I myself trip on every hour of the day. So, it's just little things that we can pick up in the environment that can help with safety. And then I guess just the last thing, because I don't want to talk too much about this, but we talk about someone who needs specific care, but we often forget about their spouse or loved one. And I often get calls for help because the caregiver who's been taking care of someone who has Alzheimer's or a dementia, as an example, just went to the hospital because they're so tired or worn out that they don't look at themselves needing just a little assistance. So just being there to give folks a break, some time to themselves. And I think it's interesting in this time, we're all kind of learning what that feels like as we're in our homes during this pandemic. We're getting a sense of what that feels like. So those are just I don't know if that completely answers the question, but those are some of the things that we feel are important.
No, I liked how you said that it's customized, because everyone's situation is different, and I know that you don't say that to be sort of elusive, with the answer. Everyone's situation is different, and we want to customize it to fit the needs of the client. And that's good.
And I'll tell you that, on the personal care side, those are challenging things to take on. And so the simplest way is let us come in and do all the care for you, so you can just go back to being family, and enjoy that time.
Yeah. And I think when I think about this and taking on the task of caregiving or aging in place, or preparing to, downsize and declutter so that you can age in place, or whatever it is, the amount of overwhelm that we endure, it basically paralyzes us. There's so many things to do and so many choices to make that we just don't do anything, that's not the right thing either. Now we're getting into where maybe some people are living in unsafe, environments, or like you said, falling and breaking a hip, just getting up to get a glass of water in the middle of the night. So Sara and Leah, you want to speak to that?
Yeah, I would just say, as far as the best resource for aging in place, I mean, obviously I'm be a little partial to the home care side of things, but I do think if you have a home care agency that you're starting with, you know, even if you're starting with companion care, so take any sort of personal care needs, all of that out of it. If you're just starting with a very simple few things that you need, if you're with the right home care agency, they're going to transition with you as your needs change through the duration of being at home. And that's, like Patrick said, wherever home is. That's could be a standalone home. It could be in an assisted living community, memory care units. I mean, we work wherever you are, where you're needing additional support. So, you know, one thing for us is that we have that registered nurse case manager that follows every client's care needs through the duration of them being a client with us. So, you know, if we start with one thing and in 3 months we need to add in a few pieces because you're needing a little more assistance or things just feel a little more unsafe, that's part of continuing that relationship and changing your care needs as they change, as you need more or sometimes less. You know, sometimes we have people that improve as well. So just having that agency be able to transition with you in what your care needs are. And then that home care agency should be your resource when you need additional support as well that they can't provide. So whether that's bringing in physical therapy with a home health agency, or if at some point there is some hospice care needed, then we're going to work with that agency as well and make sure that you're getting everything that's needed so that you can age in place and safely.
In terms of aging in place, an adult day center very much is that ideal option because nobody spends the night. Everybody goes home. And we play very well with hospice care, home health, respite stays. On average, a person who utilizes adult day services uses them for 2 years. Personally, in 16 years of doing adult day services, I've had people that have used it for the entire 16 years that I've been within the industry. We've had people that use it for 6 months before needing more care or before they passed away. So to echo what Patrick said, it's very individual as to what options and kind of what menu the person needs to age in place safely and with that high quality of aging.
Yeah, that's great. I just did a talk yesterday about the importance of relationships, and we talked about how loneliness is the same damage to a person as smoking about 15 cigarettes a day, which I haven't smoked in a really long time, but isn't that like half a pack of cigarettes a day or something? It has the same health decline effects as 15 cigarettes a day, which is crazy. So going to someplace like Joy's House offers that socialization piece that if you are choosing to age in place or age in home or wherever that might be, just be sure that your loved one or you're getting that socialization. And especially now, I feel like we all have to be very intentional about getting some human interaction. Just, if anything, to know that we're not alone in the up and down emotional roller coaster. So, okay. Sorry, I muted myself on accident. We'll get on to the next question. If we don't have any other specific ones about that, I don't see anything in the chat box or online. So it's our last question, and then we can open it up for general questions. And then, if you guys have any extra special wisdom to impart on our guest, is the cost of home health and home care covered by my insurance? So we talked a little bit about this. We can cover maybe something that we've missed. And then also, if you're able to, I know that everyone's customized and it's really hard to sort of give an average, but if you're able to, like maybe the average cost that someone might anticipate for different levels.
Yeah, so I think we touched on how Medicare is really the big driver for the home health and hospice side as far as a payer source. And we walked through kind of on that on the home care side of things. Cost range. So how home care usually works is it's based on the number of hours and number of days that you'd like to have. So we charge an hourly rate. It's anywhere from $25 to $28 an hour. You can have as many or as little hours as you want. But Sara brought up a great point. We too have registered nurses that come in and can kind of help consult you on that. And it's not about getting more hours. It's about safety and the care needs that you have. And then the other side of it too is, we are scheduling caregivers to come out for that specific time. And so in this day and age, we're finding that caregivers driving to and from places for about an hour or half an hour of service isn't conducive to something that they are willing to do in the market. So we have a minimum number of hours for a caregiver to be there for a visit. Ours happens to be 4 hours. So again, you can have as many hours and as many days as you wish. We just come in and kind of schedule that.
Yeah, as far as the home care piece, just to kind of go over them again, I mean, generally private pay, long-term care insurance, Medicaid, and then your veterans aid and attendance are going to be your most normal, most common, I guess, that we see as far as getting your home care services covered. And it may not cover all of it. It may cover a portion of what you need. Just depends. But and yeah, our services same. I think kind of across the board in general in the Indianapolis area, $25 an hour. So would probably be a good number to use if you're averaging things out. We have a range of anywhere from 24 to 30 an hour. And just like Patrick said, it just depends on what you're using. If it's shorter shifts, our rate is actually a little higher. And then as you use longer or have more hours, the rate drops down. So it's different for everyone depending on what you need. But like I said, I'd use probably around $25 just if you're wanting to calculate some cost of what you're thinking. That'd probably be a good number to use.
And how about Joy's house?
So some long-term care insurance policies will reimburse. Again, it's dependent upon how the policy is written. A full day, which with COVID, our hours are now 8 to 5, is $75. And then at the UIndy house, because it's a little cozier, it's $70 for the full day. A person can come for that full 8 to 5, or they can come for 4 or 5 hours based on, again, individual and what is best for the guests and their families. We do offer a scholarship because we know that a lot of the people we serve fall into that they're not quite eligible for Medicaid, but cost is prohibitive when you start adding up all of the other expenses. We never want to be that bill that they choose to pay over medicine or over another absolutely necessary thing in their life. We also have been known to work with families to help them get the VA aid and attendance or choice or Medicaid waivers. So we're always very open with our families about the financial component.
That's great. I feel like there's a little bit of a gap where you're talking about and where you offer scholarships. That's great, between needing a little bit of care and not needing enough care to get, you know, financial support for that. So that's good. So I'm going to open it up for just general questions. If you've got any, you can raise your hand, you know, just unmute yourself and shout it out. Type it in the chat box here to everyone, or if you want to message someone privately, you can also do that too. If you're on the phone, *6 on your phone. If you're on Downsizing Indy Facebook page or on YouTube, you can type it in the chat box there. I have both opened. That's why if you see me looking around everywhere, I'm looking at all of those places. So I also typed in a link to the door prize registration. So we have Stacy Bones giving away her wonderful basket that she always does. She's with Clear Captions. She's been an in-kind sponsor this year. She makes these baskets and they're amazing. Sometimes I think when we were in person, whoever won, they needed help to carry the baskets out. So we're doing that, and then the $25 gift card. And Mr. Callis, yours is in the mail, by the way, from last month. So that was my fault. Any questions? What about, while we're waiting to see if questions come in for the three panelists, what is your biggest piece of advice that you can give to our crowd here?
Yeah, I think one thing I would do is I wouldn't be hesitant to have some of these conversations with your physician or your loved one's physician. It is good information to kind of work with them. Second, I'd say home care, it doesn't have to be permanent. It can be very temporary. It could be just simply to get you back on your feet. Maybe you just had a surgery or a setback. And so many times we're just there for a couple of days, even just to get you back on your feet, to, you know, avoid, again, those unnecessary hospital stays. And then, you know, just from a mindset perspective, and I'll be very honest, I had wrist surgery myself a couple of years ago, and I feel really bad for my wife because I'm going to be a terrible patient for her. But when I got assistance, you know, when she was helping me with some things, aging in place isn't a dependent thing. You actually are more independent when you have the right assistance. And I had a lady who was over 100 years old who we drove to a bridge tournament every month in Castleton. And she cleaned the floor. She dominated. And so she was able to go do those things because she couldn't drive her car anymore. We helped a spouse go out and get an anniversary gift for her loved one, which, because of Alzheimer's, she had trouble remembering those things. So, but I really felt like we made them more independent than really dependent.
That's a good way to put it. What about you, Sarah? Sarah and Patrick, I messaged you both privately a question that came through also.
Yes, I see that. Well, I think my biggest piece of advice for anyone thinking or just wanting to educate themselves on home care is to do it now. It never hurts to just have a sit-down conversation where we go through all of your individual specific questions, just share with each other what it is you're looking for and what we can provide. I do a lot of those with families where I call them meet and greets. We just come, we sit down, we meet each other. Let's talk through your questions or your specific concerns, or anything that you just may need a little one-on-one attention about and questions answered. Don't hesitate to do that now. I have families all the time that I will have talked with years ago, 2 and 3 years ago, that will call back and say, you probably don't remember me, and I usually do. So just because they needed that information then, and they were proactive, and now something's happened and they knew what their plan was, because they had those previous sit downs where their questions were answered. So don't hesitate to do kind of the front end work. Don't feel like you have to wait until there is that more immediate need. So that's my advice. I think the question that you sent, Lee, says, let's see, 66-year-old nephew and 3 friends want to be our home health aide. Can they work, train with you, and then be assigned to us? BrightStar does not have our own training for CNAs. We don't have the school like Patrick does, but we do work one-on-one with our caregivers once they're hired. For us, it would just be a matter to see if they meet our qualifications for hire. We do look for 1 year of experience prior to hiring our caregivers. So we would just have to, on an individual basis, see if they meet what our qualifications are for employment.
Oh, I will let you answer that part to Patrick and get to you too, Leah. Sara, that you made some good points, and for the attendees that have come to these events for a while, you all know what she's talking about when we say plan early, start planning early, because you hear it in every panel. I think is like the best piece of advice. Plan now. Don't wait for an emergency, because then it could be more costly. You could maybe not receive the services that you need because you're beyond a certain guideline for that particular care or financial service. So start the planning process now. And I get calls from attendees all the time. We're getting prepared. So you guys are listening. So that's great. Leah, did you want to hop in there? Your best piece of advice?
Yeah, I'm going to echo exactly what you said. Have those conversations, have them earlier rather than later. And I would also add to try it. It's okay to try a service and decide this one's not for me, or it's not for mom. And I always tell families this. We had a family who I said, okay, start by telling mom that you're going to give it a month. 2.5 years later, she was still on her 1 month trial because it worked for all the parties involved. And it saved that family. We've also had the opposite, where somebody tries it and it's pretty obvious it's not a fit for that family. So then we do utilize our community partners and help them find things that will be a fit. The other thing is use the resources on this call. There's so many people within the home and community-based service industry that want to help. Yeah, we want you to utilize our personal services, but if it's not a good fit, I don't know of too many that won't recommend you to another service.
Yeah, that's a good point. I think most everyone is in this industry because they have a passion for serving seniors, because they had a personal experience like Patrick and his family, or for whatever reason, they just love on some seniors. So Patrick, did you have anything that you wanted to add to the question that came through for you and Sara?
Yeah, so right now, the state of Indiana is, for those who qualify, are helping pay for training for anybody who wishes to get certified nurse aid training. So, and I can put it on the site, it's called nextleveljobs.com. We are one of those providers. And like Sara, we too would have those individuals go through our interview process. And if they qualified, absolutely, we would hire them, and we would work with you on seeing if it's a fit. I just want to add to the planning, because that is a key. Two things. One, I think Leah and Sara would agree, probably every client we've met about a week or two later say something to the effect of, I wish I had known about you sooner. You know, and I can speak from as a caregiver myself, I wish I had known about this sooner. So that's one thing. The second thing is, how do you start the planning? One of my, when my grandmother-in-law passed away, we needed to find her husband's death certificate. And we found a lot of pigeonholes in the house. We never found that document. And so one thing we just tell our families, it's just a good exercise to start these conversations, is where are your important documents? Not what's in them or what the balance is, but just where is your checkbook? And there's a list of things on our website that you can check out, and just making a list of kind of where those things are. As a family, that is very helpful down the road with, if there's an emergency that, you know, there's one less stressor to think about. But you start thinking about these things. You know, what type of services do I want? Where do I want to go? It could be a good helpful start.
Yeah, that document piece is good. And one thing I thought of when you were talking too is it helps to bring in a third party sometimes, like anyone on the panel or any of the sponsors, depending on where you're at. I had someone message me this week, and we had set up an appointment to meet his mom, who's widowed, and she's living in her house, and she just, it's not safe for her to live there anymore. And so we set up the appointment, you know, no big deal. He texted me back later and said, you know, I mentioned this meeting to my mom and she flipped out because, you know, she's not on board. And I said, well, you know, can I just have a conversation with your mom? I mean, can we just have a phone call together, she and I? Because I'm not related. I'm not in that family, you know, circle drama situation. And if it's not, you know, so, but the point is, a third party, we could be saying the same exact thing that you've been saying to your mom or dad or your loved one or your, you know, your significant other. When it comes from us, sometimes for whatever reason, it's just received differently than, you know, you could have been saying the same thing and they were adamant about no. But yeah, for whatever reason, sometimes it lands differently from a third party. So, okay, Patrick put in that website there in the chat, Next Level Jobs, for the attendee that wanted some training for family members, which I think is a great idea, by the way. If you are going to do it, I think educating yourself is one of the best things you can do for everyone involved. It doesn't look like we have any other questions. I did post that. Oh, somebody unmuted their mic. Does somebody have a question on the phone? Am I missing somebody? I'm looking here. I don't see any hands raised. Again, *6 on your phone. Okay, I'm posting.
I would like Patrick, Sara, and Leah's phone number so that I can call them. I'm not computer savvy.
Is this Jean?
Yes, it is.
Jean, I will send everything your way. Do I have, well, I know I have your phone number. Do I have an email for you?
No, you don't.
Well, we talked just before the meeting. I'll give you a call and I will put a packet in the mail to you.
Okay, very good. Thank you.
Yeah. Anyone else? *6 on your phone to unmute your mic. And then that the door prize link, I'll share it again if you are interested in entering the door prize. I'll share it here in the chat box, and if you're on the phone, don't worry, we will include you there too, so you don't miss out on the opportunity. This is the biggest crowd that we've had in quite some time, and it's really great to see everybody, to quote unquote see everybody. I know it's not ideal, but I miss you guys, and I can't wait to get back in person. We're looking at how we can do that safely for everyone. The last thing we want to do is be unsafe. So we're looking at doing that, and I promise we're working hard to continue educating everybody. So if there are no other questions, I think this is it. Stay tuned. December we have. Oh, thank you, Julie's reminding me with the screen share here. December we have some actual downsizers themselves speaking about their experience. And then also, Laura Roman alluded to it a little bit when she was introducing herself. We're doing a virtual bus tour at her place, so they're practicing their run through. But we've done a couple of those this year, and they've really turned out nicely. It's a good opportunity to see the community and get your questions answered directly from the team members at Westminster Village North. Laura, I don't have the date in front of me, but do you?
It's next Thursday, the 19th.
Oh, there you go. Oh, November. I was thinking December. I have somebody else on them. Yes, next Thursday. Thank you. So next Thursday, if you'd like to RSVP for that, go to downsizingindy.com, or you can call us at 317-731-2289. Okay, speak now or forever hold your peace. Isn't that how it goes? Thank you again to our sponsors. There's Sarah's information too. And again, this will be posted on our social media sites and on our website.
Yeah, thank you for having us.
Thank you.
Yeah, thank you guys. Enjoy the afternoon.
Bye now.
Bye now.
Sarah, when is the December gathering?
Oh, the December gathering is December, looking at my calendar, the second Thursday.
Okay.
December the 10th is our next downsizing or Indy Senior Living series. But next Thursday, November 19th, is the bus tour with Westminster Village.
Oh, I've been to Westminster Village several times, and it's lovely.
It is.
I would love it there, I think.
You probably would. It's a great community.
And I need Patrick, Sara, and Liz's phone numbers, and any agencies that you have names and phone numbers for coming into my home to help take care of my husband with Parkinson's.
Okay, I'm going to call you right now as soon as I end this meeting.
Okay, thank you. Bye.
Okay, bye, Jean. See you guys.